Pecha Kucha is going to begin with a reintroduction to HIV. HIV stands for Human Immunodeficiency Virus. It is the virus that can lead to acquired immunodeficiency syndrome or AIDS. Unfortunately, the human body cannot get rid of HIV. This means that once you have HIV, you have it for life. An effective and safe cure does not currently exist, but scientists are working hard to find one and remain hopeful. However, with proper medical care, HIV can be controlled. To quickly re-emphasize how HIV came into contact with humans, the source of HIV infection in humans has been identified to be a type of chimpanzee in Central Africa. Scientists believe that chimpanzee versions of immunodeficiency version of the virus was most likely transmitted to humans and mutated into HIV when humans hunted chimpanzees and came into contact with their impacted blood. The symptoms of HIV vary based off the stage of the virus that an individual is in. According to AIDS.gov, in the early stages of HIV, some people may experience flu-like illnesses within 2 to 3 weeks after an HIV infection. Flu-like symptoms can include chills, fevers, night sweats, and muscle aches, among other symptoms. These symptoms can last anywhere from a few days to several weeks. The second stage of the virus is known as the clinical latency, HIV inactivity, or dormancy. In this stage, people may not have symptoms or get sick during this time. For people who aren't taking medicine to treat HIV called antiretroviral therapy or ART, the period may last a decade or longer, but this period may also be a lot shorter because they are not taking ART. People who use ART every day may be in this stage for several decades because treatment helps keep the virus in check. The third stage of this virus is known as the acquired immunodeficiency syndrome AIDS symptoms and can include rapid weight loss, diarrhea that lasts for more than a week, memory loss, depression, and other neurologic disorders, among other symptoms. According to the CDC, without treatment, people without AIDS typically live about 3 years. HIV is treated using a combination of medicines to fight the HIV infection. This is called antiretroviral therapy, ART. ART isn't a cure, but it can keep the virus in control and reduces the chances of the virus being spread. ART prevents HIV from multiplying and helps the immune system. By having less HIV, it allows for the immune system to recover and better fight off infections and cancer. HIV is grouped into 6 drug classes based on how they fight HIV. According to AIDS.gov, the 6 drug classes include more than 25 HIV medicines that are approved to treat the HIV infection. In regards to drug classes, they are sometimes available in combination where 2 or more HIV medicines are combined into one pill. When someone has HIV, it is recommended that ART is started with a regimen of HIV medicines from 2 different drug classes. The choice of HIV medicines to include in an HIV regimen depends on a person's individual needs. When choosing an HIV regimen, people should consider possible side effects of HIV medicines, any issue that can make it difficult to follow an HIV regimen, such as a busy schedule that can change from day to day, and cost of HIV medicines. Selecting the best HIV regimen can depend on these factors, among others. Knowledge and awareness is also very important. A study from EBSCOhost discusses that although partners knew their sexual intercourse would put them at risk for HIV, that they were fine because they would regularly use condoms. EBSCOhost then discusses that based on a study that was performed, that knowledge and awareness that a lot of people partake in choosing to only use condoms is not sufficient and that they need to go get tested as well. Having HIV can also take an enormous emotional toll on the individual. People with HIV tend to have strong emotions towards anxiety, depression, fear, and unhappiness. This type of behaviors have impacted the way that people with HIV felt and conducted themselves in everyday activities such as work and leisurely activities. Having mixed emotions can also lead people with HIV to stay away from different types of treatments. Some people with HIV continue to feel reluctance towards infusion and avoid blood products after learning of AIDS. Their emotions causing reluctance towards blood products is a crucial issue pertaining to treatment because of the risk of worsening their clinical condition. The refusal of care has become too common among people with HIV. According to NCBI, with a study done, it stated that 20% of those who qualify for treatment refused to initiate ART, and the leading reason for ART refusal was given as feeling healthy despite the individual not having proper cell counts and other internal issues. Many people also refuse the care of this medicine because they associate it with making them less healthy or beautiful. Some individuals associate starting ART and other HIV treatments with becoming ugly and dark in complexion, or with a change in shape such as getting a huge stomach and arms that would make someone look like a weightlifter. People living in South Africa felt an externalized stigma in their communities if they would decide to take HIV treatments. They felt that if they initiated treatment or continued on treatment that they would be framed as being derogatory. People in a study said that they feel that if the community had found out that they had HIV treatment that they would face social isolation. Another key factor that contributes to the refusal of care is increased financial burdens. Starting treatment was often viewed as insurmountable challenge in a life already burdened with an inability to meet one's basic needs of one's family. People in poor communities often have issues with unstable housing situations, food insecurity, and unstable transportation, among other issues. People in poverty are so consumed with their current burdens that they do not wish to take up a new one. People also made informed decisions against taking ART and other HIV medications for religious purposes. They commonly invoked a strong belief in God as a provider and healer. They then discussed that God as the larger force and that HIV could be considered a punishment that only God has the power to cure. However, other groups of people that describe faith in God as guiding forces with their decision making found it acceptable to take ART along with other HIV medications. They believed that God was a healer, but that starting medication was necessary since they were of flesh and earth and that God could only heal if you take your medication. People who were for and against medication often used herbs and sought the counsel of traditional healers instead. They also seek out immune boosters in the form of supplement or vitamins. Friends and family members would recommend this as a way to enhance or substitute treatment. These natural forms of therapy are often viewed as being a more natural form of therapy. People who have described having strong social support from family found it much easier to take ART and other HIV medications. The fact that they were able to disclose their status often made it easier to mitigate the challenges associated with starting treatment. This support helped addressing stigmatizing beliefs that people had by allowing people with HIV to feel a sense of humanity. Overall, NIH has concluded that there is a link between connectivity and social integration that may help people cope with fears, concerns, or stigmas that they may have. The social cost that people incur in a community will not be as big of an issue if this link is present. This is because this link will provide those who test positive with sufficient support to promote effective coping strategies and overcome fears related to treatment initiation.